What if the fatigue, weight gain, brain fog, and low resilience so many women experience in midlife weren't signs of decline, but signals? What if aging wasn't something happening to you, but something you could actively influence? Longevity medicine isn't about living forever. It's about protecting your energy, strength, cognition, and independence for as long as possible. Today, we're unpacking what truly drives health span in midlife: metabolic health, hormones, muscle, and daily choices, and why this decade quietly shapes the decades that follow. Welcome to All About You. I'm Dr. Shauna Watts, GP and women's health advocate. Every week, I bring you evidence-based conversations to help you navigate midlife with clarity, confidence, and far less confusion. My guest today is Dr. Catherine Johnson, a menopause specialist, obesity medicine physician, and emergency medicine board-certified doctor with over 25 years of clinical experience. She's the founder and medical director of Precision Medical Care, a concierge practice specializing in longevity medicine, metabolic health, and hormone optimization. Today's conversation is about longevity medicine. Not biohacking, not overhyped anti-aging trends, but the grounded, science-backed foundations that help you live better for longer. By the end of this episode, you'll understand what longevity medicine actually means, why metabolic health matters more than the number on the scale, and why midlife is such a powerful window for prevention. As always, this podcast provides general information only and is not a substitute for personalized medical advice. Please speak with your healthcare provider about your individual situation. Dr. Catherine Johnson, I am so privileged and delighted to have you on the podcast. Thank you for joining me.
Thank you, Shauna. I'm glad to be here. You can call me Catherine.
I'd love to jump into a topic or a word that seems to be very popular at the minute, and that's longevity and longevity medicine. And it often gets kind of lumped together with things like biohacking and supplements and anti-aging culture, and even, people wanting to go to extremes of thinking of living forever. But whenever you kind of clear away all the noise, what actually is longevity medicine, and what is it not?
Great question. So I see longevity medicine as precision medical forecasting, which means that our aging trajectories are predictable, quantifiable, and modifiable. So when we personalize and really look at each person, we can say, okay, you may be aging based on your blood sugar levels being high. You may be aging because you have a higher cancer risk. You may have issues with sarcopenia, frailty. So, longevity medicine is trending, if you will, but all doctors are longevity medicine doctors, right? We all are interested in delaying the onset of chronic disease if we can even prevent the onset of chronic disease. But aging in of itself is only recently by the World Health Organization determined to be a condition, the condition of aging. It's something we can study, it's something we can predict, it's something we can modify, and each of our aging trajectories is different. So what I would say when I see things trending about longevity, it's usually not nuanced or personalized. It's usually signaling that's very binary. You should do this for your longevity, take this supplement for your longevity. When the truth is, it's very nuanced how we're aging. We all age differently. Our organs age at different rates, and we age differently based on different environments that we're in, too. Our genetics, our environment, our lifestyle. And I love to study it. And I think really the science of longevity medicine will probably be integrated into each person's physician's specialty. I know my ophthalmology friends are looking and they can see aging through, doing retinal scans. I know reproductive endocrinologists are looking at aging based on your ovarian aging. Um, there are so many ways that we're aging, and I think it's pretty cool to like figure out how you're aging. and what you can do about it.
Yeah, I agree. And I think you're absolutely right. Really, all doctors ultimately are longevity doctors because we're all trying to keep people as well and as healthy for as long as possible. Whenever people think that it just means living longer, lots of people will say things like, "Oh, well, I'm here for a good time, not a long time." Um, and but what do we actually mean whenever we're trying to think about someone's longevity? And what's the distinction between a lifespan and a health span?
Yeah, I think the real issue is to compress morbidity. So it's true. A lot of patients, just as you said, will say, Doc, I don't need to live a long time, just a good time. And what I'd like to see you do is have both. You can live a long time and a good time, not that this last few years of life is with disability, with frailty, with a lot of times in the hospital. And I think we can really ideally think, how would we like to live our fullest life? I, as a emergency physician by training, I've witnessed so many people dying, and I do think it's merciful when there's less suffering. And I think if we can optimize, if you will, the health span, compress the morbidity, and actually have vitality for more years in our age with strength, resilience, and really wisdom. I think that, especially in women, as we age, these are usually our happiest years until we have disability and we lose our independence. So when I look at each patient, I think, okay, I want to take care of what's going on with you today, but also look forward to where will you be 10 years, 20, 30 years, and how can I take the data I have for you today and predict where that will be in the future, and how can we help you to age later?
And so whenever you talk about morbidity, can you explain to the listeners what do we mean whenever doctors talk about morbidity and we talk about mortality, what are we talking about here?
So in medicine, we think about it as, what are your activities of daily living and how independently can you function? So your ability to feed yourself, dress yourself, bathe yourself, move yourself, enjoy interactions with other people, be independent, unburdened, if you will. And anybody who's had an injury, maybe they sprained their ankle. For me, I've had a hip replacement. You never feel so vulnerable as when you can't even put your own socks on. You can't, your gait speed changes. All of a sudden, you're moving more slowly. All of a sudden, you're realizing, oh my gosh, I have a bit of a handicap. I need a little more time. I need some more support. I need to phone a friend to help me do the things, even to blow dry your hair if you have a shoulder injury. Um, those are the things I think that really speak to one's quality of life, is being independent. It's important that we're in community and taking care of one another and helping one another, but we also, I think, when we're autonomous and independent, do we feel the most healthy.
Yeah, agreed. And midlife is often framed as being like a downhill slide, really. And I think that you and I are very aligned in that. I think both of us see it as like it could be a real pivotal opportunity for particularly women in midlife to take stock and maybe, really take the opportunity for, some self-care, some introspection and seeing how they want to move forward in life. Is that sort of your take on things?
Absolutely. I'm in my 50s, and I tell women as they're getting older, listen, you never have to do your 20s, 30s, and 40s again. How awesome is that? Those were years of a lot of struggle, a lot of uncertainty, a lot of anticipation. You're building, you're growing, you have objectives, you're taking care of your children, you're taking care of your family, you're really getting after your career objectives. And as our hormones change and we're less people pleasing, we can be, really stronger than ever because we just don't care as much what other people think. And I think that's such a liberating superpower for a woman, and men too. I think as we get older, we realize who are our real friends, who can we count on, We also have experienced vulnerability. We have respect and appreciation, most of us, for the fact that life is so precious. And how can we make impact? How can we take what we've learned, use our time efficiently? And what I try to do in my practice is help people realize you can age with grace. That often comes with creating space from other people that deplete your energy, that have taken from you, and you can choose where you wanna give, and you can also learn to start taking, the grace and the kindness from others, and when you don't see it, distance yourself from it.
Yeah, absolutely. So, Catherine, I'd love to chat about what is happening biologically in this window of time of midlife that makes it such a powerful time for intervention.
Well, I think, really, there's so much predictive medical forecasting we can do even before we're born, right? So I think, when we think about what is precision medicine, which I practice more than I would say I'm a longevity doctor, I'm really a precisionist. And I really try to think to myself, who are you genetically? What have you inherited? And that can come from your ancestral imprint of trauma, that can come from the environment and how you're born, what your mother's been exposed to, and then also what is the birth history, the exposure to infection, the exposure to environments. There's so many factors that go into how we age. I would say, to answer your question, there's so many factors that go into it. And I think really what I want to do is help people see where they are today, where they've been. They tell me where they want to be. And we try to put together a plan to give you all the scaffolding based on the data so that you can age later.
Yeah, absolutely. And I think, in midlife, I think there's often well, there's many groups of women, but there's definitely a group of women who feel kind of mostly fine, but kind of subtly off. They're kind of more tired. They're finding it harder to recover from things. They're not quite themselves, but they almost will be a bit apologetic when they come in to see me because they're like, oh, look, I'm not like my friend who's got horrendous hot flushes, or I'm not like my other friend who can't sleep. But they definitely don't um, they're just not feeling themselves, and they're feeling suddenly their age. And I think that perhaps traditional Western style medicine has probably overlooked that type of um, feeling because, they're not unwell enough. And I think, we've probably for a long time been taught in a system which is all about fixing a disease or fixing an illness. So if someone comes off and they've got, these just very subtle sensations of they don't have as much energy, or they're just not feeling like themselves, but there's not really lots of symptoms to chase. You know, do you believe this is still a person who warrants someone taking a really close look and seeing what's going on? Or is it just a case of, oh, well, that's just aging and, you're 50 now, so that's how it's going to be?
Whew. I, I mean, really, this change that we see in midlife for every man or woman, they start to experience. Especially for women, it's achy, itchy, witchy, sweaty, sleepy, bloated, forgetful, moody, super snacky. And I think we each have a different tell for how we experience it and which organ system we really feel it. So some women really experience the cognitive changes, the energy changes, the joint changes, the libido changes, the motivation, and I think to honor each woman because she will present to different doctors with these vague complaints, and it's as you said, it's not pathologic enough to warrant aggressive management, but when you start looking at somebody integratively, and start studying how the hormones change, you can see that this decline in our receptors for estrogen, progesterone, how our cortisol, insulin levels are changing, how we feel less like ourselves, and that's the number one symptom women will describe is, "I just don't feel like myself." And men experience this too, but they just kind of miss themselves, the energy, the vitality, but it's easy to say, "Well, work is stressful, the kids are stressful, my parents are sick, there's so many other things." And especially as women, we just are basically taught to suck it up, try harder, the problem is you. And so if you work out more, you should be able to lose the weight. If you calorie restrict more, you should be able to lose the weight. If you tried harder, you wouldn't feel so tired. But when you do a deeper dive and you start to put it together and you look at all of her, and then I like to check the hormone levels and just show her this is where it is, this is where it's been, this is how it's trending. It's very chaotic. Often that's very validating. Um, and I believe, listen, I'll always validate your feelings, but when I start showing you data, we can really break down why you don't feel like yourself.
This episode is brought to you by my 16-week Rediscover You program, designed specifically for women navigating the challenges of perimenopause and menopause. If you're dealing with disrupted sleep, mood changes, or unexplained weight gain, this evidence based program combines medical guidance, practical tools, and a supportive community to help you take control of your health. Women have reported significant improvements in symptom management of sleep quality and overall well being. As an All About You listener, when you mention the podcast, you'll gain priority access for our next intake. Click the link in the show notes to learn more and join. I'd love to help you rediscover the vibrant, confident version of yourself. And Catherine, if we could jump into the data, what kind of things are you seeing in midlife that perhaps traditionally, maybe doctors aren't always checking? Because I definitely have a lot of women who come to see me. They're clearly perimenopausal. Some of them are really in hell with their symptoms, but they might go and see a doctor who goes, "Oh, I've checked your hormones and they're fine." And obviously it's so frustrating. But what other things are you noticing on people's laboratory testing?
Well, the laboratory testing is just a snapshot in time. So I think looking at data chronologically, longitudinally over time can be very helpful. So what we tend to see as we age is that the blood sugar is going up a little bit and then a lot. We see the weight is starting to change and where the weight is carried is starting to change, the fluid retention, the energy levels, the blood pressure is changing, the cholesterol levels are changing. So there's nuance in where we look at the classic biomarkers of aging, which would be the cholesterol, blood pressure, waist circumference. But the nuance would be looking very carefully at what's happening with the nutrient levels, the hormone levels. And it's true, they change so dynamically. And I think it's helpful to know each woman if I could, and I hope in the future, and I think this is what's so exciting about the future, is we'll have basically the ability to trend these markers over time and show a woman this is what your estrogen testosterone levels are when you're ovulating in your 20s. This is what it looks like when you're in your 30s, 40s and beyond, and how does that correlate with her energy and how each woman is very different in how she experiences that transition. And it's not just one data point, it's how you trend data over time.
Absolutely. I think
So
what's interesting is obviously testosterone has become, chatted about a lot more than it ever was even 5 years ago.
mhm.
Um, but what is a little frustrating is that there's very few women who've actually had a testosterone level, in their 20s. And
Yeah.
very occasionally you have someone who has had one for various reasons, but they're literally one in 100 or less, and you can see that sometimes what we're saying is the normal range. These people had a much higher testosterone level whenever they were younger, and so although again they're still sitting in the normal range, and they probably are feeling the effects of their declining testosterone levels. So as you say, I think we need to start as doctors really looking at trends more than just a number on a day. Um, metabolic health is definitely something that is becoming talked about a lot more. And more we're talking about things like inflammaging and that, your metabolic health is the quiet driver of aging. But yet when a lot of people think of the word metabolism, they think it means all about their weight and what they weigh. And sometimes people think they've got a slow metabolism or a fast metabolism. Um, can you explain what actually do we mean by metabolic health?
It's a great question. So, classically, metabolism metabolic syndrome is defined with certain biomarkers related to blood pressure, fasting glucose, cholesterol levels, waist circumference, and blood pressure. So, these start to creep up and show that there's a change in the metabolism. And if you take a careful history, even in the absence of these biomarker trends, you'll find that she's thicker around the middle. She's a little more tired. She is gaining weight even though she's been eating the exact same diet, exercising the same amount. There are shifts to our metabolism as we age, but fundamentally, it has a lot to do with our sleep, our stress, the hormones of cortisol, insulin, for a lot of women, up to 20% thyroid, autoimmune issues, especially now we're seeing more immune disruption. And I would say, too, especially in America, metabolic syndrome, prediabetes, overweight, obesity, high blood pressure, high cholesterol, we're seeing these patterns in much younger people. And I do think this is related to some endocrine disruption, environmental issues related to the food, the stress, the environment. And unfortunately, we're seeing precipitous aging in our younger patients. And I think this is an opportunity too. When we think I trained in obesity medicine, 20% of the curriculum in obesity medicine is PCOS, polycystic ovarian syndrome, which is fundamentally an impaired metabolic syndrome because there's androgen excess, which starts to change a woman's physiology where she's she's aging and starting to show signs of a different metabolism when it comes to her insulin and cortisol levels related to the androgen excess. So, again, back to your statement about trending testosterone levels, some women, testosterone can really backfire for them. It doesn't just give good energy and good muscle tone, but it can come with lipid issues, excess weight, insulin resistance. So, every woman is having a different profile and different change experiences with her diet, her environment can influence what's happening with her hormones.
Yeah, absolutely. And like you said, every day I see women who come in and tell me, it's so unfair. I'm still going, some of them are going to the gym 6, 7 days a week. They're not changing what they're eating. And yet they're just feeling their weight is just endlessly creeping up. They'll often grab their belly and, they'll say, like, this is so unfair. I'm being so good with my diet. I feel like I'm doing everything. And it can be really disheartening. And even for women who've maybe gained, literally 3, 4 kilos, they can be as upset as the person who's gained 10 to 15 kilos because it feels like it's outside of your control. Um,
It is. It's outside of her control. She's really pulling the levers that used to work and they don't work anymore. And that is a metabolic shift. It's a shift in her hormones as part of the aging process. It's extremely frustrating. It happened to me. I was always pretty lean. And in my perimenopause, I had a lot of excess estrogen, endometriosis, adenomyosis, a lot of inflammation. I gained 60 pounds. A lot of it was just fluid, insulin resistance, and it really is hormonal, and we know this from being pregnant. You can be hardly eating anything and you're gaining weight. Hormones can cause excess and changes in weight despite calories in, calories out, and all this perception of I should just go to the gym. In fact, I often prescribe to women, don't set your alarm to go work out. I want you to sleep more restoratively. And we really do have to think about what's going on with the hormones, treat the hormones. And this is where, too, why I trained in obesity medicine is because it really is your hormones more than it is your calories in, calories out, and how many minutes you spend at the gym.
So, what are the levers that do work, or what are the new rules that a lot of women feel they haven't been told, the new rules that seem to be governing their body from midlife onwards?
So what happens to most women, and of course, and as a precision, it's not all women, but most women after the age of 35, they're seeing progesterone decline, which starts to present as sleep insufficiency, increased anxiety. And when we see the sleep patterns change, we see the stress levels change, cortisol levels go up. Cortisol is our endogenous stress hormone. A vital hormone, but when it's dysregulated, it correlates with excess glucose. When glucose is higher in the system, it may not be because you just ate, something with a lot of sugar. It may be your adrenal glands creating a surge of cortisol because of stress, because of trauma, because of less progesterone. Whatever's going on there with stress is real. Cortisol goes up, blood sugar goes up. When blood sugar goes up, insulin goes up. Insulin is a hormone that regulates, is the energy in your body to be stored or to be burned. And so when you have higher insulin levels and higher glucose levels, this is how the body starts to create stored energy instead of burning the energy. So this is called insulin resistance. And it's very common as in perimenopause. We're starting to see cortisol levels become dysregulated. We're starting to see blood sugars going up. Even if the fasting blood sugar is low, we may be seeing glycemic excursions related to stress, disrupted sleep, and suddenly whatever was working for her before is no longer working. And as estrogen's really important for insulin sensitivity. As estrogen goes down, then we have another variable coming in. Then she starts gaining about 1 to 2 pounds a year on average after 35 all the way through 65 per year. And then you start seeing this compounding effect of inflammation, excess weight, her blood pressure's going up, her cholesterol's going up. Maybe now she has sleep apnea, and she's telling her doctor, I'm tired all the time. And they're not always putting all these pieces together.
So I want to just jump back a little bit to cortisol because I'm finding more and more patients are definitely more educated. They're watching doctors on social media. They're hearing cortisol, stress. And I think if I think back to like 10 years ago, did anyone ask me, could they have their cortisol level checked? Not really. Now it's a frequent request. People say, "Can you check my cortisol? How can I fix my cortisol?" So, well, how do you approach that? Because it's not quite as straightforward as, in my mind, as just doing a little blood test and going, "Oh, yes, your cortisol is high, and this is what we're going to give you this tablet to fix it." It doesn't work like that.
It does not work like that. Really, you can tell a person's having dysregulated cortisol when you take a proper history. And especially if you examine them, you might start to see they have changes in their body that express this insulin resistance and stress response. But checking the cortisol level, if it's urinary cortisol, if it's serum blood level of cortisol, cortisol is supposed to be highest in the morning to get you out of bed and give you a surge of energy. So that's one of my favorite questions to ask people. Do you wake up before your alarm with good energy? That usually speaks to your circadian rhythm is intact. Many people are having dysregulated cortisol, so they're waking up tired, the alarm's going off, they're feeling sluggish, their cortisol isn't appropriate. Maybe it's firing at night and they can't go to sleep. Their thoughts are ruminating. They're wired. They're tired. So, cortisol, checking the level is just a snapshot. If I could put a continuous hormone monitor on people, then we could really get a better idea. But if you talk to a patient or a person, you'll understand they're not able to go to bed at night without ruminating thoughts. feeling really wired. And then they end up staying up too late and they just perpetuate this cycle. So, dysregulated cortisol, you can check it with there's a 4-point urinary test, or sorry, salivary test. There's also blood tests. I check the blood tests in the morning and I check them over time. And I find it really interesting and pretty predictable that cortisol levels go up as FSH goes up. FSH is follicle stimulating hormone. So as estrogen goes down, cortisol goes up. And this is the body that can also be a hot flash, a night sweat, anxiety, ruminating thoughts, worried a lot, your body hurts, you don't feel good, you're super snacky, you're super irritable, your cortisol levels up. And then you start gaining weight because when cortisol's up, your blood sugar's up, so your insulin's up. And there goes this vicious cycle. Even though you're hardly eating anything, you keep getting, a thicker belly.
Yeah, absolutely. If we strip back what the kind of the trends are at the minute, so we've gone through see people all into ice baths, and then everyone's into saunas. Like saunas are massive here. Lots of people have saunas at home. And there's lots of other things that, people are thinking about, various supplements and things they can buy online. I do practice lifestyle medicine, so I think that there are some lifestyle things that you can really do to change the trajectory. But what do you think actually moves the needle most? Because I sometimes worry that people are getting caught up on the latest sort of trend, and maybe actually missing the mark on the thing that's probably going to move the needle most for them. What do you reckon the things are that people should really focus on?
I really think you have to protect your peace and create some space and grace around toxicity. Many women are unfortunately living or have lived through violence and trauma, and they have a difficult marriage, a difficult work environment, they have a child with special needs. These are all things that are dysregulating her cortisol level and often outside of her control. And we know it's very well studied. Women with special needs have shorter telomere. When the children have special needs, their telomeres are shorter. So we're only as healthy as our least healthy child. So sometimes our stress response is so high because we're so worried about our kids, our parents, our loved ones, our what our boss thinks of us. We're terrified because we're living with a narcissist or we have a narcissist boss. So I think for a lot of women, it's appreciating that maybe they don't feel safe because they're not safe. And how can they get help in that regard is something I work with a lot of patients because I can show you your cortisol level is 30 in the morning before your divorce and then after your divorce. And that's very validating for a lot of women. Um, but many people, they're be basically so chronically stressed, it's causing all of this impaired metabolism. Um, But the lifestyle things are so important. The breath work, humming, going for a walk, the sauna. I mean, when you're in a sauna, you're probably, not dealing with other things that would stress you out. So that's good for your nervous system.
Yeah, absolutely. You mentioned telomeres, and I don't want to get into it in great depth, but can you just give us a quick snapshot? What is a telomere, and what does it mean that if your telomeres are shortened? So you mentioned that women who have children who have a health condition or a disability seem to have shorter telomeres. Tell me, what does that mean?
Well, back to longevity, the telomere is the chromosomal length. And so this length of the chromosome can predict one's longevity or health span. And so when we see shortened telomeres, we're seeing aging. And so Elizabeth Blackburn, who won a Nobel Prize for discovering the telomere and its correlation with health, identified that it was really women who had children with special needs had the shortest telomeres. And I think about that a lot, especially practicing obesity medicine. It's really, and I came from emergency medicine, but seeing how trauma and stress impacts a woman's health is tremendous, both from a chronic level and an acute level. And I think about it like this: when we talk about cortisol, if I'm a physician prescribing prednisone, a steroid, to a patient, I will make her or him a diabetic. I will make them weak. I will make them manic. They'll have poor bone density. They'll have poor muscle tone. When your adrenals are so stressed, they're putting out this cortisol all the time from trauma, from violence, from stress, from worrying. It's a similar patient. Diabetes, poor muscle tone, osteoporosis, osteopenia, and mental health disorders. So I think whatever we can do to support our nervous system so that we're managing our dysregulated cortisol better is so important. And when we're dealing with politics and a lot of public health issues outside of our control, I think a big part of it is just thinking to yourself, what is within my control? What can I do? And if it's outside of my control, how do you let it go? How do you radically accept that which you cannot change? And that can be so transformative to somebody's health trajectory, is to just radically accept that they can't change what they're so mad about. They can only change their reaction to it.
Yeah, 100%. And so I have to say, in my clinics, I put a big focus on, first and foremost, getting sleep sorted out. I think sleep is really foundational, and hopefully people don't need to spend a lot of money or buy anything terribly expensive. Of course, it's nice to have a bedroom that's got, curtains that block out the light, and you've got bedding that's comfy and all the things, and you've got a room that's cool. But personally, I think that if you can get someone sleep better, we all know how we feel. If we've had a good night's sleep, we do feel generally like ready to conquer the world a bit more. But also we know that you're going to make better food choices. Your cortisol levels are going to be better. And you're going to be less likely to ask for, carb heavy snacks. So I personally think that sleep changes so much in someone's moving forward. So that's a really big focus for me. Is that something that you focus a lot with your patients?
Absolutely. So I like to think of anchor sleep. So we try to anchor a set interval, if it's 6 to 8 hours a night, depending on what a patient's preference is, that we set aside that time. That is protected sleep. So you do everything you can to protect that sleep. So we create habits of sleep hygiene, some rituals, to just as we did when we were, putting a baby to bed, we just ritualize the sleep experience. And this is what really happened to my health being an emergency physician working night shifts and things. We see this data in shift workers and people who are, they have disrupted sleep schedules. They have higher incidence of obesity, cancer, all chronic disease, because we really should be following, ideally, the circadian rhythm, following the sun. I tell my patients simply, let's anchor your sleep. Don't eat after the sun sets. Wait to eat until after sunset. Try to follow the phase of light. And now we have so many disruptions to our light dark cycle because of electronics. But if you can stick to that, rhythm, at least with your feeding, your sleep, try to protect that sleep. I think you can do so much to improve your health. But, people have real jobs and they have real problems where that may not be realistic. So we want to give them every metabolic advantage we can when it's not possible.
The other thing that's very topical in midlife health is muscle and strength and, I'm not sure what it's like in the US right now, but in Australia, it is a very active outdoor lifestyle on the whole, but you're definitely seeing lots of women walking around with weighted vests, lots of women taking up strength training, lifting weights, which is amazing to see. And then there are obviously lots of women who are a little bit anxious about this. They've maybe got a sore neck or a sore back or the sore shoulder, and they're a bit scared of it. But I think that's the thing that's really interesting to me, even as a doctor, is that when I was at medical school, very long time ago, um, we didn't really learn about muscle as it being something that was kind of metabolically active. It was more like we learned the names and, what bones it was attached to and what it did. And I think, obviously medicine has progressed a long way, but I think still a lot of people think of muscle as like a big lump of beef or a big lump of meat that just kind of moves their body around. But it's so much more than that. Why is muscle something that's so um, is sort of ingrained in longevity research at the minute? And what is it about muscle that seems to predict your your health span? What is the connection and
Mhm.
why should people be so motivated about their muscle?
Well, muscle really is an organ of longevity. It's a metabolic endocrine organ. So it's signaling to your brain, to your liver, it's signaling pathways of energy storage. It's a glucose disposal network. I mean, when we say, oh, men can lose weight so easily when they change their diet. It's because they have more muscle. So as a woman, I'm tall, petite women, they have less muscle just because there's less, skeletal muscle available for them. So it's easier when you have more muscle, even if you're lean and longer. It and that's why too, when you have more muscle, you have better metabolism. When you have more muscle, you have less frailty. As we age, frailty is a big deal because we call this the obesity paradox. Excess weight is a problem, but too little weight is also a problem. And as we age, muscle will always weigh more than fat. It's very dense and strong. And it's really your fridge of energy is in your muscle. So it's important to preserve muscle. It's also, I think, important to realize you don't have to overtrain your muscle. You don't have to over consume protein to maintain healthy muscle mass. We have good muscle mass. Movement is important, wearing a weighted vest or not. It's really just keeping your body in motion. This concept of many Americans have is I'm going to go to the gym for an hour and then sit for the rest of the day. No, we should be moving all of the time. I remind my patients who have lost 20, 40, 100 pounds, you used to carry that around. Go lift it. Go stay active, stay moving. We lift our children, we lift our groceries, park further away. We have a comfortable complacency lifestyle because we have a lot of advantages as we've evolved. But that is really unfortunately creating a pandemic of sarcopenic obesity, which means you don't have a lot of muscle, you have more fat than muscle, and when you sit more, you're not building muscle. So even when you're sitting, you can sit up straight, you'll burn better. You can squeeze your glutes. You don't have to lift super heavy all the time, but you do have to like feel a little like engaged with your muscle. It's so biologically active.
Yeah, absolutely. Do you feel that like BMI is still something that you measure and use as a tool, or do you think that you use like fat mass index, or do you not really use any of those measures?
Oh, I look at all of it. So BMI is a screen, but it's a pretty crude screen. So 2% of people will have a falsely elevated BMI because they're so well muscled and muscle weighs more, but their percent body fat will actually show that they're quite lean. Um, More often than not, what we see is a lower BMI, but a higher percentage body fat, a higher visceral fat. So, really, what we should be looking at is the waist to hip ratio, the waist to height ratio. We should be, if we can, and I have these at my offices, a body impedance analysis, which will show what you weigh, how much of it is muscle, how much of it is lean mass. Lean mass includes water weight. And a lot of times, too, people will say, oh, you're going to lose muscle and lean mass. Losing water weight sometimes is healthy if it's bloat. And a lot of the advanced scales we have will show you what is the extracellular water versus intracellular water. And as we age, that's what inflammaging is. You just bloat your water instead of keeping it in the blood vessels to perfuse your vital organs with oxygen.
Catherine, I have a group of women who I see who were who are in their 60s, 70s and beyond, and they're the group of women who went through perimenopause and menopause and hormones were pretty much off the table. They were in that era of having menopause when the WHI was influencing the vast majority of practice, and these women are they feel sad and a bit that they've been left behind and they feel depleted, and some of them are in that age group are absolutely fine and great, but there are a group of women who feel like they've never slept well since they've gone through menopause 20 plus years ago, and they're feeling like, what is there for them? Is it just all too late, or are they still someone who can be helped? And I'd love to know your take on that. And I know it's a very generic person, but I think you know the group I'm talking about.
Okay. I sure do. And I'll tell you, irrespective of age, we should look at every woman individually and really get to what's driving her her issues. Often when she's not sleeping well, she will improve with estrogen, progesterone for sleep, but not all women who are in their 60s and 70s will benefit from hormone therapy. And now we have some newer therapeutics that are modulating the neurokinin pathways, and they sleep beautifully on those medications. In my practice, everyone gets, of course, vaginal estrogen. Systemic estrogen, progesterone really depends in my practice on what's going on with their metabolic health, what's going on with their gut health. Because if I give a woman, actually a younger woman too, hormones without having everything else healthy, she may, only have more fluid retention, excess weight, not feel that much better. So I think we have to look at every woman integratively. Something's very interesting about women in their seventh decade and beyond. They actually make a lot of testosterone, a pretty decent amounts. It's very interesting. So I find that interesting. I like to track the FSH, and I find that the higher the FSH, usually the more symptomatic the woman. And there are women who just have more adrenal and ovarian function of androgens, which can be very protective of their bones, of the perimenopausal transition. Um, if there's excess weight, I want to treat the weight before I add growth hormones. Growth hormones include estrogen. And I think estrogen is important to women's health. If her body hasn't seen it in over a decade and she has excess weight, I want to really get the weight off, help her with the lifestyle, the gut health, and then we can talk about adding it in while we're thinking about every risk benefit. Usually there's benefit, but it's so nuanced. And I really think we have so much to learn about selective estrogen metabolism for women.
Thank you so much, Dr. Catherine, for such a grounded and empowering conversation. What today really highlights is that aging isn't passive. It's shaped daily by how we move, eat, sleep, and manage stress. Longevity medicine brings us back to agency, not perfection or extremes, but informed, intentional choices. If this episode sparked curiosity about your own metabolic or long-term health, take that as an invitation to ask better questions and seek care that looks beyond symptoms alone. You'll find links to Dr. Johnson and Precision Medical Care in the show notes. And as always, this information is general in nature and not intended to replace personalized medical advice. I'm Dr. Shauna Watts, and I'll see you next time on All About You.